Use Stockinette for comfort, padding or 10 cm web roll to protect bony surfaces and general protection, 15 cm plaster of Paris for the slab, and 10 cm for the stirrup. Trauma scissors, cold water, crepe bandages and tape. The patient can be positioned supine as demonstrated here. If you position them prone, you'll need an assistant to hold the leg in position. If supine, a towel under the knee can help for comfort. The ankle flexion to 90 degrees or the neutral position, and the subtalar joint and hindfoot is neutral. Estimate the length of the plaster by laying out the dry splint next to the area to be splintered, and this can be measured against the uninjured leg for patient comfort. 12 layers of slab along the posterior leg, 8 layers for the stirrup from above midcalf to above midcalf on the other side. The distal margin is the metatarsal heads on the plantar surface. Continue beyond the toes for phalangeal fractures. The proximal margin is 2 cm below the head of the fibula. Ensure adequate analgesia prior to the procedure. Clean and dress wounds as you normally would. Apply the Stockinette to the leg beyond the margins of the plaster, allowing enough to fold back. Apply 2 to 3 layers of the web roll beyond the plaster margins, proximally and then distally. Ensure the heel and malleoli are well padded with web roll, overlapping itself by 25 to 50% with minimal creases. This will increase comfort and stability of the final back slab. Submerge the pre-prepared dry back slab in water until bubbling stops and remove. Squeeze out the excess water and smooth either in the air as demonstrated, or you can use a flat surface. Apply on the posterior leg starting from the base of the toes and extending up the leg. Submerge the pre-prepared dry stirrup splint in water until bubbling stops and then remove. Squeeze, smooth and apply from halfway up the calf on one side under the ankle to above midway up the calf on the other. Turn back padding around the distal and proximal margins of the plaster of Paris. Apply the crepe bandage firmly over the slab and fasten with tape. Gently mould plaster of Paris to the patient anatomy, maintaining position until hardened. Once the crepe bandage has been secured, further moulding can occur.